Hello, my name is Taylor Banks. I'm an allergist practicing in Maryland, where I'm a clinic chief and an associate program director, and I'm pleased to be speaking to you about latex allergy. So what is latex allergy and who's affected? There are really three categories of latex allergy. The first is an immediate type reaction. This would be characterized by symptoms such as hives, difficulty breathing, and sometimes severe symptoms like a drop in blood pressure. The second category is more of a delayed type reaction. Most often skin only in terms of a rash. This is most often due to chemicals and accelerants used in the latex processing rather than the latex itself. The third category are patients who develop oral or throat itching, sometimes lip swelling, and this is with foods that have cross-reactive proteins to latex. Examples of these are avocados, chestnuts, kiwis, and bananas. Now, certain patient groups, such as those affected by spina bifida, have an increased incidence of latex allergy. Also, folks engaged in certain areas of industry, such as healthcare workers, those in the rubber industry, and also gardeners or those engaged in domestic or hospitality services also have an increased risk of latex allergy. And this is because of their contact with some of the more frequent forms of latex, things like gloves, balloons, also medical and dental products and equipment. So how then is latex allergy diagnosed? History really is the mainstay and the most important tool in an allergist's toolkit. And the elements of the history include the timing of onset of symptoms after exposure to a latex product, the type and severity of those symptoms, and each and all of these elements should be inquired about by your allergist to better understand if you may have a latex allergy and the likelihood of that latex allergy as well as its severity. Now, turning to other forms of diagnosis, there is no FDA-approved extract for skin prick testing. A blood test does exist. Unfortunately, it's not sensitive enough when it's negative to effectively rule out latex allergy. For those with a delayed type reaction, patch testing is available, and this is a determination based on your history and some other factors of past reactions that your allergist can work out with you. Now, as far as management, when a diagnosis is made or suspected, how do you then manage that or treat that latex allergy? Really, avoidance is the mainstay of treatment. And being able to identify yourself as latex allergic is important. This would consist of identification such as a bracelet or a necklace, and also just being very open about a potential or suspected latex allergy with medical providers or dental providers. I hope these have addressed some of your questions. Thank you very much for your time.